coming up from the Northeast Live Studios in Guwahati. Northeast Tonight with Wasbir Hussain.
Hello and welcome to this special broadcast, The COVID Puzzle. We are continuing to invite top medical experts on the show to help us understand the puzzle involving COVID-19, to answer some of the frequently asked questions, as also to bust some of the myths surrounding coronavirus. Joining me tonight, Dr. Yatin Mehta, head of the critical care department at the Medanta Medicity, the Medanta Institute of Critical Care, a pulmonologist who is one of India's best known critical care experts. Also on the show, Dr. Madhumita P, professor of medicine at the Guwahati Medical College and Hospital. Also with me is Dr. Nilom Khaund, a senior physician at the Apollo Hospitals in Guwahati. Ladies and gentlemen, welcome to the show. Let me go straight to you, Dr. Yatin Mehta in Gurugram, the chairman of the Medanta Institute of Critical Care. First of all, thanks for your time. Very glad you could join the show tonight. Question is, Dr. Yatin Mehta, there is a perception, and it's also almost real, that the medical experts, the medical fraternity is faced with a lot of challenges as far as tackling the second wave of COVID and the treatment. A lot of questions are being raised on the treatment, a lot of use of steroids and so on and so forth. Of course, the treatment protocol is also evolving. Dr. Yatin Mehta, how do you look at the situation?
See, the second wave actually, to be honest, has hit us much harder than the first wave. The thing we talked about, that the elderly people were more susceptible, still remains true. But I see a lot of younger patients also coming in without any comorbidities to the ICU. So, I mean, the severity can be not pretty bad in them also, and I'm losing some patients because of that. So this time we were totally caught on the wrong foot, unfortunately. The infrastructure was totally swamped by the numbers which were hitting us. And on top of that, the shortage of oxygen and the medicines also hit the medical facilities very hard. So we were under a lot of additional stress. I mean, it's not only a question of staff shortage and excessive working hours and the risk to the staff, the illnesses in the staff of COVID, they were falling sick and obviously requiring time off. But on top of that, this shortage of oxygen and the necessary drugs was pretty strenuous to all of us. Now, on top of all this,
right,
the new,
Dr. Mehta.
Yeah.
No, please carry on, complete it.
Yeah, so in addition to all the things which I talked about, there was the new fungus, the black fungus, which has also come up. In the past, I used to see about a couple of patients in 4 to 6 months. I'll say about 4 or 5 in a year. Now we are seeing almost a couple of cases every day. And on the amphotericin shortage also,
right.
Fortunately, I hope they're able to take care of that. But that is making it worse.
Dr. Mehta, is it the lack of basic things like oxygen? Is it the lack of oxygen, or is it the virus mutating and developing an entirely new character that is leading to this problem? As you said, even younger people without any comorbidities are being forced to be shifted to ICUs.
See, it is possible. I mean, the genotyping has not been done that extensively in a huge number of patients. But that is very much a possibility that the double mutant, or so-called 1617, I do not want to name a country after that, but that may be the one which is different from the previous COVID-19 virus. And that's why probably it's affecting the people in a different manner. It is spreading more widely So obviously, certainly it is more infectious than the previous wave which hit us. And I am seeing extensive lung damage in these patients who remain in the ICU for a very long time. They become oxygen dependent, and the lungs are very badly damaged in these patients. So it is possible that this is because of the mutant. And the antibody response of the body, you do not know. These are all studies which are going on, and this will take some time to be revealed what exactly is happening and how your body is reacting to the new variants.
Right. Let me turn to you, Dr. Madhumita P. Das, Professor of Medicine at the Guwahati Medical College Hospital. Dr. Madhumita, okay, let me go to Dr. Nilom Khaund then. Dr. Nilom Khaund, as cases have started increasing until a week ago, I'm talking about the all India figure, as cases mounted, do you think doctors and hospitals were under some kind of pressure to go in for aggressive treatment to bring down the mortality? And do you think that has again resulted in complications? My question is simple. Do you think doctors are using too much of steroids and too much of aggressive treatment, which is doing more harm than good? This is also one of the perceptions. Is it a reality? Is it a myth?
That is a possibility, definitely, because we are dealing now with a more dangerous situation than the last time. We have worked in COVID last time, we have worked this time as well. By the natural selection, the virus mutated and it is become more virulent. It seems the transmission is also, the transmission rate is also more. So, we get more, we are getting more serious patients now. The lung involvement is definitely more than what we had seen last time. We have ICU which is full with high flow people requiring quite a high flow of oxygen. Last time we did not see that much serious patients. So, definitely the stress will also be there to deliver a good medical care. But I feel it is not just one thing that is causing all the difficulties that we have seen in COVID. The black fungus, the thought that we are using more steroid. So, there are multiple factors which can cause a situation like this. A fungal infection in a ICU in a critical care illness, critically ill patient is not unknown. It is there from before. Mucor might be a new thing that we have seen in more numbers now. Candida was there. There are a lot of fungus that are there.
Right.
One who works in ICU will understand. But a critically ill patient, to handle a critically ill patient is a challenge, is definitely a challenge. And maybe we are more aggressive in treating those patients, and I think my message will be to go by the rules, to go by the guidelines. We are not caught in a wrong foot when we go by the guidelines. That is a point I will like to highlight in through your show.
Okay, okay. Right, absolutely. Let me go back once again to Dr. Mehta. Dr. Yatin Mehta, a lot of people want to know now, Uttar Pradesh, for example, has declared black fungus as an epidemic, but a lot of people want to know whether black fungus, is it an infection, is it a disease in itself?
No, see, it's a fungus which occurs in soil, water, air. So it normally happens in patients who have poorly controlled diabetes and on the immunity is suppressed, maybe because of steroids. So that also contributes. And also it grows well in high oxygen concentration. So all these patients who are sick because of COVID, they require high oxygen. So that also adds to the thing. The hygiene and the infection control practices on top of all that are not as good in present COVID times as they would be in the non-COVID times because of the staff shortage, because of the PPE, long working hours, and so on. So this all adds to the thing, and on top of that, certainly there is a gross misuse of steroids in the community. People are popping in steroid tablets on their own, or maybe the GPs and the doctors outside may be using it extensively, when many times it is not required. So that contributes to the problem. And many times the patients pop the tablets themselves and they ignore it when the eye is black or when there's a blackish discharge from the nose. They'll ignore it, come back very late. By that time, the game already may have been lost.
Right. Now again, a lot of people want to know, Dr. Mehta, is there an effective antidote to black fungus? Yes, we have seen a guideline from the ICMR giving out, prescription details as to how to treat black fungus, so on and so forth. Is there an effective antidote really?
There are only two ways to treat this disease. Most important is source control. That means if the disease tissue has to come out. So if there is a sinus which is infected, it has to be surgically removed endoscopically. If the eye is infected, many times the eye has to come out, enucleate the eye. Okay, so whatever the source, it has to be removed. And only then the antifungal drugs will work. And the drug of choice, there are only limited drugs which work against it. The drug of choice remains amphotericin B. Unfortunately, there is a shortage of that. I hope that is corrected pretty soon. And there are a couple of other drugs like isavuconazole and posaconazole, which are available now in India. But these are all expensive drugs, and they have to be all administered in hospital patients, not as an outpatient. So that also is a drain on your resources, not only in terms of expenses, but in terms of the bed occupancy and so on and so forth.
Right. Now, we are also joined by Dr. Madhumita P. Das, Professor of Medicine at the Guwahati Medical College Hospital. Dr. Madhumita, welcome to the show. We are discussing, we have Dr. Yatin Mehta on the show, and we have got Dr. Nilom Khaund on the show, Dr. Madhumita. We were discussing black fungus. Now the issue is, why is it that black fungus is reported so much in India, and we are not hearing about black fungus from other parts of the world? Is there any particular reason? How serious is the issue in your view?
Actually, Wasbir, I have missed the first part of the discussion. I don't know what has already been stated, but black fungus we have not seen a single case of black fungus in our hospital. I work in Guwahati Medical College. We are treating hundreds of COVID and post-COVID patients. I haven't seen a single case of black fungus. We have suspected, but when we send the samples, they have come negative. I have just heard in the news that there has been a report from a private hospital. I'm not very sure about it, but it's difficult to say at this moment for us whether COVID is directly related to the black fungus or it's because of the use of steroids, as it has been stated in the media largely. But with whatever experience of steroids we have as a life-saving drug, I find it very difficult to believe that steroids can be the cause of black fungus. Perhaps it is related to COVID in some way, which is going to unfold over time. I don't know what has been discussed. Right. I missed the first part of the show.
Right. Dr. Nilom Khaund, Dr. Yatin Mehta has said that unhygienic conditions could be one of the reasons why black fungus could be, prevalent in India, or it has cases increasing in India, because COVID is leading to a lot of pressure to the hospitals and medical community, medical fraternity. And there are a lot of people who are saying use of steroids. Dr. Madhumita said that she cannot directly see a link between steroids. There are a lot of factors. What do you think? Have you come across any cases of black fungus in your hospital?
Yes, there had been a case a week back in our hospital who expired, and that was the news that came out in the media. And from our hospital, we had given a public statement about it. For me, if I go back to my MD days, we were taught there was a holy trinity of uncontrolled diabetes, inadvertent use of steroid, and an immunocompromised state. If you go into more detail, you will find the fungus having a relationship with altered iron metabolism and other things which are also seen in COVID. So, all things taken together, you cannot only blame the use of steroid. You will be because steroids has been used for ages now for all other diseases. How did we see mucor then? We didn't. The mucor was not an issue before. It has become an issue because of so many things, of which maybe a unclean mask, maybe the humidifiers that we are using are growing it, the immune status of the patient, the iron metabolism of the patient status. On top of that, we ignore the diabetic control, we use inadvertent steroid for a longer period of time than it should be used. All things taken together, we are seeing this surge probably of mucor.
All right. Okay, let me go back. Let me go back once again to Dr. Yatin Mehta. Dr. Mehta, just a general question, non-medical question actually. A lot of people would like to know, Dr. Mehta, do you think fatigue within the medical fraternity, doctors, paramedics, do you think that could be slowly impacting on COVID treatment?
No, I don't think so. I mean, we are psychologically affected, all of us. It has been going on for too long. But I think our medical fraternity has stood by like a rock. And look at the way they are performing under the most adverse circumstances. I think hats off to them. I mean, doctors, paramedics, nurses, everyone has solidly worked to fight this pandemic, and we must appreciate that. I don't think fatigue has anything to do with this, but the spread of the disease has a lot to do with the fatigue of the public, because they were fed up of staying indoors. So we lost complete control. I mean, you look at the gatherings which were happening in the last few months, for whatever reason, they have significantly contributed, no question about, for increasing the numbers.
Right. Now coming to vaccines, Dr. Mehta, coming to vaccines, which is believed to be the most important means by which we can take control of COVID-19. Now, a lot of people want to know, can someone who got Covishield as the first shot, can that person take Covaxin or any other vaccine for the second shot?
That's a good question, Mr. Hussain. Yesterday I was in a CME and I said the same thing. Don't mix your drinks. So if you have taken one shot of Covaxin, please go ahead with second shot of Covaxin, and similar for Covishield. There is no scientific basis for trying a different vaccine as a second shot, because the way they work are completely different. So although in the UK they were going to try that, but I hope they have given it up, it makes no scientific basis to do that. So you must take whatever vaccine you get. And also for a common public and audience which is listening to us, I must say, don't be very choosy about which vaccine you get. You get a chance to get a vaccine, please cancel all your other work and get the vaccine shot.
Now, there seems to be some confusion, Dr. Mehta, on the gap, what is an appropriate gap between vaccination shots? If you look at the Indian context, Covaxin is given at an interval of 28 days, whereas as far as Covishield is concerned, now the latest guideline is that you have to take it after a gap of 12 weeks. So, is there a confusion there?
No, science is evolving. We must say it's a dynamic situation. This disease did not exist until 1.5 years back. So we are all learning over a period of time. The history of mankind, no vaccine has developed this fast. So we are still learning about it and evolving. But as it stands today, Covaxin should be taken at the 28 days gap. For Covishield, it is a given that the immune response of the body increases with the increasing time lag, up to 3 months of time. So I was also one of the first guys who took the shot in my hospital, and I got my second shot at 1 month because that was what the government's recommendation at that point of time was. But now, fortunately, the government has modified. Part of the modification may be because of the shortage of vaccines. I agree with that. But my again advice to all your audience is that 2 to 3 months is a good time to get your second shot. Generally, 12 to 18 weeks is a bit too long, I think.
Okay, I'm just coming back to you. Let me go to Dr. Madhumita for a moment. Dr. Madhumita, now everybody is talking about immunity, how to boost one's immunity. Now, which are some of the common immunity boosters that healthy individuals can go for or practice or take actually? What are some of the common immunity boosters? Because that is the catchword these days.
I think the concept of, am I audible, Wasbir? Can you hear me?
Yes.
Okay. The concept of immunity
Yes.
boosters, so far as food or lifestyle is concerned, is more actually business gimmick is what I would say. Because medically, we do not have as such too many concepts regarding immunity boosters. But yes, a balanced life, exercise, a balanced diet, and then nowadays they talk about turmeric and all of these herbs are supposed to help in the boosting of immunity. But yes, there is a role of vitamin C, there is a role of vitamin D being maintained at the normal levels, proper exercise, proper health measures, taking measures to maintain good health, good diet are the ones that will help us to keep our immunity at balance. And if we don't contact any other diseases. But if someone is already suffering from a disease and is on immunosuppressants like steroids or any other medication for such, those people are immunosuppressed and they have nothing else to do to boost their immunity because their primary disease has to be kept under control. That is more important, that when we handle the immunosuppressed group of people, we should see that they are handled with more care than the general lot.
All right. Dr. Nilom Khaund, I'm going back to Dr. Yatin Mehta in a minute, but before that, let me go to Dr. Nilom Khaund. Dr. Nilom Khaund, basically a lot of people are now beginning to ask this question. Are RT-PCR tests, how correct are these tests? Is it necessary to go to double check? Is it necessary to go for a second RT-PCR check? Because there are a lot of cases where people who found that the RT-PCR test turned out to be negative, and by that they developed symptoms, and by that time it was too late for them to get a proper treatment.
See, the test is always complementary to the clinical status of the patient. It is just complementary, I am telling you, because RT-PCR negative does not completely rule out COVID, and RT-PCR negative with a CT scan which is very suggestive of COVID in a pandemic like situation what we are facing is COVID for all practical purposes. So, you may repeat the test for 3 times. This time we have seen many RT-PCRs being negative. On the first, on the second, on the third they come out to be positive. Maybe the strain which has evolved is not been picked up by the RT-PCR, that is a thing of debate. But what I feel is, if you have a patient who has a suggestive symptom, even if the RT-PCR is negative, your CT scan shows a COVID type picture, you should be treating that patient as COVID. Your clinical status is actually the reason why you will come to the hospital. It is not the CT, not the RT-PCR. The clinical status is the reason why you will come to the hospital. You are having upper respiratory, lower respiratory symptom, your oxygen is coming down, you are coming to the hospital. So, if you follow that, nobody will come late actually.
Right. Dr. Mehta, Dr. Nilom Khaund is saying that, RT-PCR may turn negative, but you should go to hospital provided, hospital if you have the basic COVID symptoms. But general tendency among the people, Dr. Mehta, is that unless they are tested RT-PCR positive, they would rather prefer to stay at home and watch the situation, may not even be taking antibiotics and without any basic coverage. So is this a problem really?
No, this is a problem. Because the moment you start getting symptoms of sore throat, fever, myalgia, general malaise, I think in the present times, one should presume it is COVID, unless proven otherwise. Now that means the moment you do your test RT-PCR, I always advise people, the moment you send your test, do not wait for the result. You should be isolated completely. And people are not doing that, and that is how the disease is spreading among the families. One member of the family gets, every member of the family gets it, because they do not take it seriously till the report comes negative. That means you presume it is positive till the report comes. Also, as the previous speaker said, that false negatives can happen in this. RT-PCR is a little different test than, say, a blood test. It's a swab is taken. If the virus is not enough in the swab, it will come negative. Or if the sample has not been collected correctly, it will come negative. So it can be false negative. It's a little different. So that means if you're negative, does not necessarily mean you're negative. But if you're positive, that means you're positive.
Now, Dr. Mehta, the ICMR has just given the approval for a home test kit. ICMR has given approval for a home test kit. Do you think that can further complicate the situation, or do you think this is a good news?
No, I think this is a good news because see, the sensitivity of this test has come pretty good. So if you get a test within a few minutes at home, you don't need to go to a hospital, A, to join the long queues for the testing, B, wait for several days for the result to come, and C, if you're negative, to go and expose yourself to other people who might be carrying the disease. So it does make sense, like a pregnancy test. You do your urine and you're pregnant or not. Most of the times it is correct. So it does make sense. And I think it may be a game changer from the public health point of view.
Okay, that's a very interesting observation. The home test kit could be a game changer. That's what Dr. Yatin Mehta, the head of the Critical Care Institute at the Medanta Medicity, is saying. I'll go for a break, but before that, very quickly, Dr. Madhumita, again, a lot of people want to know if somebody is already having cough, cold, fever, can that person take the vaccine?
It's better not. The direct answer is, if somebody is suffering from any kind of ailment, we usually postpone the vaccination. And especially if somebody is suffering from cough, cold, and fever, and even if they have done a RAT and RT-PCR and they have turned negative, they should still not take the vaccine, because as Nilom has already mentioned, that this wave and the second wave, we are getting a lot of cases who are RT-PCR negative repeatedly, but they are clinically COVID, radiologically COVID, and responding to the line of management of COVID. So you cannot say that somebody who's suffering from cough, cold, and fever takes the vaccine, and later that these are the set of people who believe that the vaccine has caused COVID in them. So it's definitely a no if somebody is symptomatic of anything and to take the vaccine. Postpone. Get better.
Okay. Dr. Nilom Khaund, now the situation is much better. If you take Assam, the situation is much better because that vaccine hesitancy does not seem to be there anymore. It's disappearing fast. That's a good sign, isn't it?
It is definitely a good sign. It's definitely a good sign. We have learned a lot when the other part of the country was suffering. We have seen it in our in our living room, the ordeal they have gone through, and we have been wiser this time. We have been wiser. So, the hesitancy is not there. The availability might be an issue for a few couple of weeks, maybe then it will improve, and I think the people will take vaccine this time.
Absolutely. We'll go for a short break. Don't go away. I'll be right back after this very, very short commercial. Welcome back. Let me go straight to Dr. Yatin Mehta in New Delhi. Dr. Yatin Mehta, can we now say that the COVID graph in India has flattened? Because there are predictions now that by July 1st, the COVID tally could come down to just about 15,000 a day across the country. Or do you think it's too early to make such kind of a prediction?
See, first of all, before I answer your question, let me congratulate the people of Assam and the administration, because despite the lower level of maybe education and wealth, I think the state has done pretty well in control of COVID. So I must congratulate you people. Now coming to your main question. Yes, I think there is a tendency to the curve to flatten. I can see that, because I used to get hundreds of phone calls every day for COVID patients admissions to my hospital. It is smoothening a bit. So I have a few beds available now in the ward as well as in the ICU. And that means people from Delhi also not coming to Gurugram now, many of them, because Delhi also has more number of beds. So I think the curve may be flattening. If you see Maharashtra, there I've talked to my colleagues, and the cases are coming under control and they're on the significant decline. You can see the numbers. Similar thing is happening. Delhi was getting more than 25,000 cases a day. It has come down to below 5,000. And the positivity rate was 25%. It's coming down to less than 10%. So I think this may be the trend. Some states may be ahead in this, some states may be behind, but I think general trend is reassuring. But let us not get too carried away by this, because this is what exactly happened after the first wave. The cases have come down and we people let our guards down and we did completely COVID inappropriate behavior, and that is why we got into this trouble. So let us keep the guards up.
Now, before I'll go to Dr. Madhumita, but one more question to you, Dr. Mehta. Is this, a lot of people again also wants to know, what about people with, who have suffered or has a history of hepatitis, or people who are schizophrenic, people who are having different kinds of problems, arthritis, for example. Do you think all these people, it is safe for them to take the vaccine?
See, if the hepatitis is active, then obviously you will not take the vaccine. But otherwise, if you got a chronic sort of hepatitis or liver dysfunction or any other illness, even malignancy, it's a good idea to take the vaccine, because the immunity may be compromised and you are more liable to likely to get into serious trouble if you get the disease. So immunocompromised patients should be taking the first ones to take the vaccine. Mental illnesses has no problem in taking the vaccine.
Okay. Dr. Madhumita, Assam, Dr. Yatin Mehta has congratulated us, congratulated the people and the government of Assam. We have a positivity rate of below 6% now. We have a positivity rate of below 6%. We are a state with 33 million people. There are more than 1 lakh tests conducted every day, and the positivity rate is below 5%. So as someone who is directly involved in the COVID management at the biggest hospital in the state of Assam, do you think the situation is under control as far as Assam is concerned?
I cannot hear
Okay,
you.
we'll go to Dr. Madhumita in a while. The same question goes to Dr. Nilom Khaund. We'll ask our producers to fix that audio with Dr. Madhumita. But Dr. Nilom Khaund, can you answer this question?
So see,
Are you comfortable with the situation in Assam?
see, if you see the US, in what happened in United States, it's a big country, and each of the states had their own graphs in a different time period. Each states had their different graphs. So we cannot be complacent that the Delhi graph is flattening and we in Assam will not go through that ordeal. So we should not let our guard down. So we may have a peak a little later than what the peak happened in Maharashtra and the other parts of the country. So we may have a little late, and we will be happy if it does not happen, but we should be prepared for that, because the same thing happened in US. If you see the US graphs, each of the states in US had a different graph, all had the different stages of the disease. So India is a big country, so we
Right.
can expect that as well
Right.
in India.
Right. So I'd request the producers to tell me if the audio with Dr. Madhumita is fixed. But before that, let me once again go to Dr. Yatin Mehta. Dr. Yatin Mehta, you know, the good news in the last 24 hours is that the International Monetary Fund has decided to come up with a $50 billion project to vaccinate everybody in the world. Now, do you think that is possible? Do you think that is going to create the necessary herd immunity across the world?
Yes, that is the whole idea. See, the herd immunity is when about 70% of a population is having the antibodies or resistance to the virus, which may be acquired in a more expensive way by getting the disease, when there is a possibility of dying also, or getting the vaccine, where you will not get the disease, but you will get the immunity. So yes, if this is a plan, I think it's a welcome move, and I think as many people should be vaccinated as possible. And this, once herd immunity comes, the virus will lose its significance. See, when we got the swine flu in India, there was a panic initially. Everybody used to panic in the ICU. We used to have separate ICU, separate this thing. Now this comes and goes. So this virus is not going to go away. It will come almost every year, but with a much less virulence and with much less price to pay.
Right. And a layman's question to you, Dr. Mehta, layman's question, everybody, this is the $1 million question. Everyone wants to know, when will the pandemic end? Will it end at all?
I'm only a doctor, Mr. Hussain. I'm not an astrologer. But logistically, I would think that by this year
Yes.
things should settle down. But we should not let our guards down. Let's not do the same stupidity which as a nation we did a few months back. Let us be on a guard. Let us follow all the precautions, and we will be all right as a nation.
Now, absolutely, absolutely. Let me come to Dr. Madhumita now, if you can hear me, Dr. Madhumita. You see, there is a global plan now to vaccinate everybody. International Monetary Fund. I was just asking this question to Dr. Yatin Mehta. $50 billion plan by the IMF to vaccinate everybody in the world. My question is, do you think it is also necessary for India to vaccinate people below 18 years of age? Do you think universal vaccination is the key? Or do you think there are some medical restrictions in vaccinating people below 18 years?
I don't think there is any restriction in including all sections of people under the vaccination scheme for COVID, because as you know, I don't know how these predictions have been made. They are thinking that by the third wave, if there is a third wave, the children will be more affected. But at least in the second wave, we have obviously seen that the first wave included more of the elderly and people with comorbidities. The second wave is including more of the younger lot, and people, the younger people, 20s, 30s, not doing very well. Outcomes not very good. People without comorbidities are not doing well. So that section definitely needs to be included. And why not the children? If it is clinically proved, if there are adequate trials and clinically proved, I'm sure if the safety profile is not a concern, everybody should receive the benefit of the vaccine.
Dr. Nilom, Khaund, what has been your experience between the first wave and the second wave? If we can take your hospital as the case study, Dr. Khaund,
Yes.
do you think more number of younger people are coming to your hospital this time afflicted with COVID?
Definitely, definitely yes. We are getting more younger patients, we are getting more sicker patients, we are getting patients who are requiring more oxygen, more high flow oxygen than what we got last time. People without comorbidities are also quite sick. And another thing that we have seen is that 14 days, 21 days beyond the test being positive, the patients are still in the ICU with high flow oxygen, the lungs are not improving. So, that is a little bit worrisome situation that we are facing. We have a ICU, we have a normal ICU, we have a COVID ICU. The COVID ICU, the patients tests become negative 14 days, we bring them out to the main ICU where the barrier is little less, and then they are stuck there for pretty some time with high flow oxygen, and half of our main ICU is almost full. So, definitely yes, and younger patients, sorry to say, but the younger patients are also being affected quite much.
Younger patients. Now, once again going back to you, Dr. Mehta, you know, now with the COVID strain, the virus strain mutating and developing into much more potent, gaining in potency. Now, do you think the vaccines which we are using now, whether it is the AstraZeneca, that is Covishield, or whether it is the Bharat Biotech's Covaxin that we are using, do you think these vaccines are going to will be able to read the new variants? Do you think the efficacy will be as much as we had planned or predicted?
That's a very good question, because the vaccines are primarily directed against the spike protein of the virus, which is responsible for the virus attaching to the respiratory cells and getting into the lungs. So the modified vaccine, or mutated vaccine as we call it, they have changed the shape of the spike protein. That means the antibody many times produced because of the vaccine may not fit into the spike proteins and may not be as effective. Although the initial distinction is they are going to be quite effective, but certainly not as effective as they were effective against the non-mutated earlier virus. But there is nothing else we have at the moment. Certain vaccines are more effective against the new certain variants, like the Covaxin is more effective against the UK variant. But I mean, that is all conjectural. At the moment, you take what we get.
So what is the message there? You know, do you think there has to be new vaccines have to be tweaked? Do you think the vaccines need tweaking? Do you think we have to work on that? Do you think people are already working on that?
Yeah, people are already working on that. If you look at the flu vaccine, which many people take it every year it's a new vaccine. You take the shot before the winter starts. So this vaccine also, people are working constantly against the mutants also. So it's an ongoing fight between the human mind and the virus. And the clever one will win, I suppose. But there's an ongoing process which will continue. Maybe, I don't know, nobody knows whether this vaccine will be required every year or how frequently the immunity lasts. But I mean, we play it by the year. So at the moment, do not worry what will happen next year. Let us all take the vaccines. Let's all practice the COVID appropriate behavior and stay safe.
Right. I'm about to close the show, but Dr. Madhumita, Dr. Madhumita, the vaccines at the end of the day is the only solution to this pandemic. We had seen or we had read about the Spanish flu. The medical science was not at all developed those days, but still, at the end, after so many people had died, the Spanish flu it came under control. So, do you think things will be pretty much easier to deal now? Do you think it's a matter of time before the medical science will be able to take control of COVID? What is your sense you are getting with the research going around the world these days?
Yes, what I feel is the pandemic raging high has got two sides to it. One, many people are dying, many people are getting sick. And the other point is more people will develop immunity out of the disease. But the question is how long this immunity is going to last out of the normal disease is not yet, clear to medical science. We do not know how long the antibodies would continue. Same is with the vaccines. As you've seen, the vaccines were initially, the vaccine Covishield, for example, was asked for 15 days gap, then 1 month, then 2 months, 3 months. People have been asking us. Now it's gone up to 4 months. Why is it that? It's because it's seen that the antibody titers that have come up with the vaccines are lasting longer. So it's an evolving process. Another report that I recently read, I'm sure Nilom or our sir here has also read it, that it's come in Nature that they're also combining vaccines in some of the people. Someone's taking Covishield. This is all in the research. This is not for someone to take. You as of now you cannot take two vaccines, but they have tried and they've seen that if you've given the Pfizer vaccine with the Covishield, the immunity is again higher. So it's an evolving process. We are yet to learn a lot of things, but the very waves, the first wave being, then the second wave being worse, I think we are going towards herd immunity. We don't know how long it's going to last. Ultimately, we'll probably have polyvalent vaccines, which will deal with many mutant strains. And with the help of science and nature, things will get under control.
Right. Final comments from you, Dr. Nilom Khaund. What is your message to the people? Everything is evolving. The virus is mutating constantly. The treatment is evolving, and everything is evolving actually. So what at the end of the day, where does the catch lie? What is the trick actually to stay safe?
We humans, you see, are always hopeful. Human as a species is hopeful. With that hope, we carry on and carry on very scientifically, not by hearsay. My message will be a COVID appropriate behavior, a vaccine, a proper vigilant, careful and proactive human being could come out of this situation, definitely could come out of this situation. We are hopeful and I am hopeful as well.
Absolutely. Right. Last word to you, Dr. Yatin Mehta, last word to you. What is your message to the countryman? What is your message to the people in the northeastern region? We are a large region, 45 million people live in the entire northeastern region. Dr. Yatin Mehta, what would you say?
So I would tell to the Northeast, my brothers there and sisters, of 7 sisters and 1 brother there, which you have. I think you have done pretty well. You should be proud of yourself. Please carry on the COVID appropriate behavior. and take vaccines the moment you get a chance to get your vaccine. And you'll be all right. We shall overcome. So have hope and we shall win.
Absolutely. We shall overcome. That is the final word from Dr. Yatin Mehta, one of India's best known critical care experts, the chairman of the Medanta Institute of Critical Care in Gurugram. And this is no time to panic actually. We have to maintain our composure and of course follow the COVID appropriate behavior, indulge in COVID appropriate behavior. I thank all my panelists, Dr. Yatin Mehta in Gurugram, Dr. Madhumita Das in Guwahati, and Dr. Nilom Khaund at our studios. Thank you very much indeed for being on the show and the viewers for watching the program. Good night and goodbye.